Hi everyone, it's Kara. Welcome back. I'm here at the People's Harm Reduction Alliance, and I'm a co-founder of the Harm Reduction Doula Collective. I'm going to talk in this video a little bit about medically assisted treatment during pregnancy. So I just want to first give the caveat, like I am not a doctor or a prescriber, so I'm hoping to do a master class video that's going to have a provider who is trained and more well-versed in the physiology of medically assisted treatment options, talk to you a little bit more in depth and provide you with more targeted questions. But for now, I just wanted to pop on here to say that while you're pregnant, you have options for medically assisted treatment. You can still access buprenorphine, you can still access methadone. Pregnancy can impact the way that these medically assisted treatments interact in your body and what your doses might be. So for instance, like with methadone, your tolerance might go way up because depending on how frequent your use or what you are using, you may need to split dose your methadone in order for it to have the effect that we're looking for. Because if we were to take methadone at the dose that would be most effective, it could have a higher strain on your kidneys. So methadone gets processed pretty heavily through your kidneys. We also don't want to give you a dose that's so high that you can't stay awake and you feel like you can't function. We want to help you maintain. So that would be a consideration when it comes to methadone and when it comes to Suboxone, is how your dose might change or be affected by your pregnancy. It's also possible to still body feed while you are receiving medically assisted treatment. The literature that I've read has shown that it's completely safe. Methadone is considered the gold standard of medically assisted treatment during pregnancy, and you can body feed on methadone. I've also read studies that show that you can body feed on Suboxone as well, or buprenorphine. With initiating methadone, because you have to go to a clinic and a prescriber, as a pregnant person, you are supposed to be triaged to kind of the front of the intake line because of your specific care considerations. When we're talking about like initiating MAT, like that is always and wholeheartedly your choice. We aren't pushing any sort of treatment options. I just want you to have the information available to you so that you can make an informed decision. And I always encourage you to talk with your providers if it's something you're interested in, to find the option that works best for you. And that's why I'm hoping to also have a master class available with a specialist in that area. The other thing I want to bring up is if you're looking to taper or lower your dose, we just want to be really mindful of what substances you're using, how you're doing that, and how your tolerance may change. So while you're pregnant, your body may have different reactions to the substances you've been taking, even if you've had that a relationship with that substance and been using it for a long time. So for instance, like you might find that you're more prone to overdose. And so it's really important that we be careful and consider how we're tapering and what we're using and who's around to support in case your tolerance drops and you get a larger dose than you think, or if you're using in general and your body may slip into an overdose kind of situation. Who's there? Is Narcan available? So we don't ever want people to feel like they have to detox alone when they're pregnant. It's actually really not advised to detox when you're pregnant because of the stress and strain and risk that could incur on baby and causing preterm birth. So there are detox options available as well. The closest one to me here at the People's Harm Reduction Alliance is the CUPS program in Ballard. It's a program in Ballard, Swedish, that is a treatment program for pregnant people. It stands for Chemically Using Pregnant Women. and it is they will take you up to 38 weeks of gestation. So after 38 weeks, they will not take you because of the risk of preterm labor and because they don't have a birthing unit at Ballard Swedish. So that is a really unfortunate limitation. There are other hospitals and other programs around the area that do have perinatal detox and treatment centers. These programs are usually shorter than a 6-month inpatient program, which is what becomes kind of standard after labor and delivery for postpartum people who are looking to go to treatment or are being required to go to treatment. It is a 6-month program, and some of them allow you to take baby with you. Other treatment options include IOP, so that's intensive outpatient. It is a combination of group therapy and in-person or individualized therapy. Sometimes it's in person, sometimes it's online. They can come alongside with randomized UAs and other things that you see typically within treatment programs, homework, or whatever the case may be. There's also just regular group therapy and individualized therapy. So those counseling programs, there's 12-step programs, there's non-denominational and non-affiliated support groups and programs. So you kind of get to like explore what works for you. Sometimes CPS is going to mandate that you do a specific course of treatment. We can, in that FTDM, which I've talked about in another video, the family team decision meeting, really fall back on a chemical dependency assessment as a tool to say, you know, we've had a clinician assess what it is that this person might need to treat their chemical dependency. And if it's not an inpatient program recommended, then we can kind of push back on that. I hope that this was helpful. I know it's not anywhere near close to an exhaustive video. There's so much that goes into this, and it's really dependent on the resources in your area. Sometimes people are able to access treatment outside of their area, and that's also an option for you, or sometimes it's the only option for you. So it's good to get in touch with what resources are in your area. If you're a support person supporting somebody who is pregnant or parenting and using drugs, do some of that digging, figure out where to get a chemical dependency assessment, figure out what eligibility criteria you or that person might need in order to screen in for that care. Some programs are more accessible than others. So this is giving us a little taster. It's starting to explore options. Please feel free to drop questions, comments, or concerns in the comment section below. And thank you for being here. I hope it was helpful.